welcome to All Things Odd. My name is Dr. Hannah Galloway.
And I'm Mary Kate.
Mary Kate is our fourth year extern, and so she's going to be here with us until May. And so she's joining us on the show sometimes. So what we always do at the beginning here, you'll see we've got our YouTube channel pulled up. You can come follow us on YouTube. We're slowly getting more and more subscribers all the time. So I think that they're easier to see here, and the thumbnail images are hilarious. And if you Google me, some of these thumbnail images come up, which I don't know if that's my favorite thing or not, but they are really funny. So you can kind of see what the episode's about, and then you can send it to somebody if you want. So they don't have, social media. So you can find us there on YouTube.
Another thing that we have going on currently is our Christmas in July giveaway. And so we are offering a little technology bundle. Comes with an AirTag, a power bank, and a hearing aid accessory. And then this could be adjusted if you are an Android user or maybe like a cochlear implant user. It can all be personalized for you. So if you go online and leave us a review on Google, Facebook, or Healthy Hearing, you can get entered to win that giveaway. And it ends in the end of August.
Yes, and you don't have to be our patient either. So we're just, trying to do some fun things to get kind of some community going. And last time we did something like this, we had a lot of people participate. So it was kind of fun. So be sure to enter for that. Give us a review if you haven't already. And today we're actually going to talk about some big nerd research that I'm really excited about. And I have a patient here right now, and Dr. Phillips was like, I feel like you really need to be the one talking about it because you're more passionate. So this study is really cool if you can get down on some research studies, but I'm just going to break it down a little bit on what it is and why it was important. And Dr. Phillips is actually going to pull up the webpage for the study. The study, that the results that we're looking at are just kind of the hearing outcomes, but overall there is a big study that the Institute of Aging has put on called the ACHIEVE study. And so she is on their website right now. If you go to achievestudy.org, you can kind of scroll through and it will tell you about the study. There's other arms of research that have not been released yet. So when I was kind of scrolling down to the bottom, the hearing research is huge all over the page because there's all these other findings that aren't out yet. So they're looking at physical function, mental health and well-being. They're also looking at healthcare use. So in this country, the baby boomers are outnumbering a lot of other generations. They are all aging. And so this research was aimed to look at what are we going to do and how can we help these people have better outcomes for their health, as well as how can Medicare support that. So it's monumental for a couple of reasons, but because the government put this on themselves, I really hope that they're going to be looking at these findings to look at what they should be covering with Medicare. So Natalie, if you'd scroll back up to that fact at the top, let's see, this one right here. So this is kind of the big takeaway. So the study was looking at older adults. It was ages 70 to 84. There were an increased risk for cognitive decline, and hearing interventions slowed down the loss of thinking and memory abilities by 48% over 3 years. Additionally, what's crazy is that we know that there are other statistics that patients wait an average of 7 years from the time they need hearing aids to the time they get hearing aids. So what just happened to their brain over those 7 years is what I'm thinking when I read that statistic. And I'm hoping that this information is going to be something that we can look at and go, okay, if we can get these people hearing aids when they need them, and they can age with these hearing aids, we're going to have better outcomes for their health in the future. I'm hoping that when some of those other arms of research come out, they're going to draw correlations draw some more findings together. Like if you have good physical fitness and you wear hearing aids, XYZ. I'm hoping that there's going to be some more kind of comparisons drawn with the rest of the research. But this is monumental for, more than one reason, but it's a big study. It's looking at kind of the aging population, which is a lot of our patients, that baby boomer generation that are getting into hearing aids. I've also found that in our clinic, I had a patient that was in maybe 2 days after this research came out, and I was all excited about it. And I told her about it, and she is totally motivated to wear her hearing aids because she saw this research. And she's in an allied health profession as well, so she appreciates this. But I think, even for my patients that are 60 years old, they have aging parents that they're currently caring for. And I know that if I'm caring for my aging parent, I want them to be able to, communicate with me and other healthcare professionals the best possible. And so this is something that, even if it's not our patients yet, it's our patients' parents, so it's something that's important for all of us. And so, yes, Natalie's got some good facts here. More than 150 million individuals are projected to be living with dementia by 2050. There was another study in the Lancet that was done a few years ago that I've talked about. And that study also was looking at dementia outcomes, and we can put a link to it as well that has some updates. But that one was also kind of pointing towards, if you're somebody who has hearing loss and you're in middle age, if you wear hearing aids, you can reduce those dementia outcomes. So it's really important for all of us that are living longer. And, most of us end up with some type of hearing loss, past age 60. So if you're really into research, it's the first randomized controlled trial to investigate whether a hearing intervention can reduce long-term cognitive change in cognitively healthy older adults. And if you look at the actual study, the way they did the analysis is very impressive. And I think that's why it took 2 years to come out, because they collected the data from 2017 to 2019. I am not a researcher by trade. I did a small research study in graduate school, but I learned to appreciate the different methods of statistics and how much goes into that. So that's also worth looking at, because the way that they analyzed it is different than some other studies that have looked at similar information in the past. Yeah, so taking away, findings suggest that hearing intervention reduced 3-year cognitive change in populations of older adults at increased risk for cognitive decline. So essentially, if you know anybody age 70 to 84, they likely have hearing loss. There are statistics that patients over age 60, even that have not been exposed to any noise exposure, like from occupation or, machine noise, concerts, whatever, those patients start to still get hearing loss around age 60. So most likely anybody 70 to 84 is going to have, some amount of hearing loss. This research is saying that if you put hearing aids on them and then measure them again in 3 years, like they're going to have less cognitive decline than somebody else that didn't get hearing aids. So the proof is in the pudding with this study. You just wear your hearing aids and you do better.
Definitely. I think that it was really cool, this study. I don't know if you said this or not, but the government actually funded it. So it was through the National Institute of Health. And so I think it's really cool that finally the government is choosing to get involved, because if you have ever gone to an audiologist, talked to someone about hearing aids, the big thing is that they cost so much. And so now that the government's getting involved, hopefully insurances will get a little bit more involved, and we can kind of get a little bit better hearing coverage for insurance for any patients that might need hearing aids. Since we know that they're going to be helping so much, we might as well make them more affordable for everyone.
Yes. Yeah. And I think too, even we're lucky to live in this area. We have a lot of patients who understand the importance and have the ability to pay for things out of pocket, even though it is totally something that I believe should be covered by insurance. Sometimes just this research is motivating for people. We printed this is just like the free version that you can get that really has a good overview. We printed it and put it in our waiting room. And when we've done that before, we've had a lot of patients, even people I wouldn't expect, that have picked it up, looked at it, and then asked me a couple questions about it. We also live in a university town, so I think that's part of it, that there's a lot more engineers and, maybe people with advanced degrees that really like research. But I think it's helpful just to inform your patients, and so that they know that you're keeping new research top of mind as well.
Also, sorry to interrupt you. This is a free article that anyone can find on the internet. If you look up Achieve the Lancet, it'll pull up on there, and you just have to make like a free account. I did it. It took me like 10 seconds to make it. Yeah. And then you can get like the full PDF, all the graphics, all the charts and whatnot.
Yes. When I was looking at it, it was saying like log in for your institution. So I was afraid it was going to tell me that you needed university credentials or that you had to pay for it. So that's great news that you don't have to pay for it. Yeah, so please give us questions about this. Look up the study, go to the website, kind of see some of those findings, and we would love to chat about it. I would love to chat about it. We will add a link in the show so that you can go to that site. And then we'll also add links for the other Lancet studies on dementia that were just a few years previous too, because this study kind of builds on that information. So hope that was not too dense of information for today's show, but we love some good research spotlights. So we'll be back soon. Usually we're back every Thursday at 12:30 on All Things Odd. Thanks for joining us. Bye.